Hello, I'm Stephen Anderson and I'm a psychiatrist in the Glasgow Eating Disorder Service. I'm going to be presenting from two of the subgroups this afternoon, the first being men with eating disorders, and then I'll also present the section on LGBT people and eating disorders. In terms of the section on men with eating disorders, our key question was, what are the most effective interventions for people who identify as male who have an eating disorder? Now, we knew that there would be little quantitative research in this area, so we also had a qualitative question. What are the needs and preferences of people who identify as male when receiving treatment for an eating disorder? We know that eating disorders affect people from all genders, ethnicities and backgrounds, and all ages, but this is not always reflected in our clinical populations and definitely not reflected in the research. Research studies have been largely conducted in young white female populations, and treatment models have generally been developed for these populations. From the literature search, no good quantitative evidence was identified which could guide the treatment of male patients. Qualitative studies highlighted obstacles and difficulties in accessing treatment. The one quantitative systematic review which was identified looked at short and long-term outcomes in males, but only in those with anorexia nervosa. Outcomes and mortality data from the studies were widely varied, so the authors decided that there was insufficient evidence to draw any conclusions which could be used to guide treatment. A number of studies had to be excluded because there were less than 10 male participants in the studies and follow-up did not last for any longer than 6 months. We know that males are often excluded from eating disorder treatment outcome research. From the qualitative research, 2 systematic reviews of 10 qualitative studies were identified and highlighted a range of views. A number of themes emerged which are very relevant for our services and how we set up and deliver services, as well as in education of clinicians and others, the early identification and general treatment of eating disorders. So those themes were recognition of the eating disorder. There is often delayed recognition in males. These disorders are seen as female illnesses. They may be minimised, or clinicians may have limited awareness of eating disorders in men. And we've heard from people that they get told that they can't possibly have an eating disorder because they're male. There may be different clinical features in males. For example, drive for muscularity rather than drive for thinness. And treatment studies need to take this into account. There may be longer delays in seeking treatment than in females, and we know that there are already delays in seeking treatment for females. Accessing treatment may be more difficult for a number of reasons. And services and psychoeducation materials are generally aimed at and set up for females. This theme also highlighted a lack of a person-centred approach in the treatment of males with eating disorders. So in summary, we have no good quantitative evidence to be able to guide the treatment of male patients. Further research is required around the identification and treatment of eating disorders in males, and work is needed to try to reduce the barriers in accessing effective and timely treatment within our services. The guideline has made a good practice point that services should encourage staff diversity in terms of age, gender, ethnicity and body image in being able to welcome every patient to our services.